Hello and welcome to May's Wellness Moment on Healthy Skin. Today we're going to be talking about different types of skin cancer, prevalence and risk factors for skin cancer, and how to prevent skin cancer. There are three main types of skin cancer: basal cell, squamous cell, and melanoma. These are organized from the least dangerous, basal cell, to the most dangerous, melanoma. The ABCDEs of melanoma were designed to help you know when to talk to a health professional about your skin. If you have any of these symptoms, you should seek the advice of a medical professional. A stands for asymmetrical. Moles or spots should have a regular shape to them. If they do not, they are asymmetrical and could be a warning sign of melanoma. B stands for border. If the border or the edges of the mole or spot are irregular or jagged, this is also of concern. C stands for color. Color does not mean black, but it does mean if the color is uneven or irregular, you should be more concerned. D stands for diameter. The mole or spot should be small, but if it is larger than the size of a pea, it is of more concern. E stands for evolving or changing. If the mole or spot has changed in the past few weeks, please go see a provider immediately. The most common sign of skin cancer is a visible change in your skin. It could be a new growth, a change in an existing mole, or a sore that does not heal. If you have a spot that you continue to pick away and it continues to reappear, you should also get this checked out. Did you know skin cancer is the most common type of cancer in the United States? There are certain characteristics that increase your risk of getting skin cancer. This could be having a lighter or natural skin color, skin that burns easily or reddens or freckles easily, blue or green eyes or blonde or red hair, a family history of skin cancer, if you yourself have had skin cancer, or as we get older, we are also at an increased risk for skin cancer. But there's good news. Skin cancer is highly preventable. In most cases, skin cancer is caused by overexposure to ultraviolet light. This comes from the sun, but it also can come from tanning beds and sun lamps. To help prevent skin cancer, use sunscreen. Look for a sunscreen that contains at least an SPF of 30 or higher. SPF stands for sun protection factor. Sunscreen should also have both UVA and UVB protection and also be water resistant, even if you're not going into the water. You want it to be water resistant so that it will stay on your skin even if you are sweating. Make sure you apply sunscreen 15 minutes before you're in the sun, as it takes up to 15 minutes for the sunscreen to absorb into the skin and provide protection. Remember to reapply if you're out in the sun for more than 2 hours or after swimming, sweating, or toweling off. You may even consider using a higher SPF than 30 because sunscreen does not always apply evenly. Make sure you spend plenty of time in the shade, especially during the midday hours between 10 a.m. and 4 p.m. when the sun's rays are the most harmful. Wear a hat. Wearing a wide-brimmed hat can also provide shade for your face, your head, your neck, and your ears. Whenever possible, wear tightly knit fabric that covers the parts of your body that would be in the sun. This should also go for your hat. Regular clothing only offers up to SPF 15 protection, but there is some certified clothing that provides higher UV protection. This also goes for your hats. If you are covering your body with clothing, it is recommended to use other forms of protection, such as sunscreen, as well. Clothing does not guarantee you will not get burned. Make sure you put on your sunglasses too. Too much exposure to UV rays can damage your eyes and increase your risk of developing certain diseases such as cataracts and eye cancer. Choose sunglasses that block both UVA and UVB rays. If you have any questions, make sure you reach out to your Everside Health and Wellness Center today. or reach out to your own primary care provider so that you can make an appointment and discuss what you can do to keep your skin healthy. Be sure to mention any changes you have recently noticed in your skin. If you are on the City of Dayton Insurance, we are happy to see you at the dock. Here are our hours of operation, and you can always reach out to me with any questions or concerns. Thank you and have a wonderful day.